Actually, I'm Dr. Osama Fekry. I'm from Egypt, hepatogastroenterologist. Actually, hepatology and gastroenterology is my expertise. Clinical nutrition is my subspecialty. I do work as a lecturer, visiting lecturer at the American University of Cairo. I know everybody is right now is tired. I see this by the count of the audience, but I promise I would be quick and it will be fun. Okay, since the pharaohs, dating from the pharaohs, mummies actually which were discovered, they noted that liver cell failure and liver cirrhosis were present in Egypt from the pharaohs, thousands of years ago. Hepatitis C is the main factor. Hepatitis C antibody is positive in 20% of the blood donors of the Egyptians. And this is declared by the WHO. According to the Egyptian Ministry of Health, statistics were conducted in 2009 to declare that 11 million Egyptians are virology positive, either B or C. And by this, Egypt would be the country number one all over the world by the prevalence of virus C. Hopefully, in the next 4 years, we are waiting for a new treatment. If you hear about the sopopivir, Sovaldi, the new treatment, the new drug that would eradicate, hopefully, would eradicate our genotype. The complication of liver cirrhosis, the burden actually in Egypt is the portal hypertension, which later on develops into end-stage liver disease, esophageal varices, and hepatocellular carcinoma. One of the oncogenic viruses, the non-oncogenic viruses, is the hepatitis C. On the other hand, we think that this number, 11 million, of hepatitis C and B is very modest. Every day we are seeing increasing number of hepatitis. Of course, we know this is a blood-borne disease. It's not except about this blood-borne, but for unknown reason, we are seeing increasing number of hepatitis C in Egypt. This is the National Hepatology Institute of Egypt. This is where I originally work. This is the place where all the hepatitis patients all over Egypt are treated. It has micro branches all over the country, and this is the place where more than 200 liver biopsies were done daily. Probably this is the greatest number of liver biopsies done worldwide. Well, how this is related to nutrition? On the other hand, Egypt is the country number one in Africa for obesity. The prevalence of obesity in Egypt is very high. This is the statistics done in 2008, declaring that about 40% of the Egyptians are the female Egyptians are overweight, and about a third of the Egyptian men are overweight. Recent statistics declare that out of every 4 Egyptian females, 3 are overweight, declaring that 77% and 46% of males. And this is the fatty liver. Of course, all you know that NASH and NAFLD is a consequences of obesity. And now the Egyptian liver is trapped in between the fatty liver and the viral hepatitis. This is an end-stage liver disease. This is a cirrhotic liver. What you see is the macronodules of cirrhosis. The factor here in Egypt is not well known. It's either the viral hepatitis C or the NASH, non-alcoholic steatohepatitis. And you never can know the difference. And you can do for every patient a liver biopsy to indicate what is the cause. This is unhuman. Liver biopsy is an invasive maneuver that got many complications. The least is pneumothorax. Meanwhile, there are non-invasive parameters to assess the degree of progression of liver fibrosis. Recently, we adopted the FibroScan. We are putting it in the new protocol instead of the liver biopsy. This would be the end of liver biopsy worldwide. But also, FibroScan is an expensive maneuver. We have also blood parameters, serum parameters that can use to trace the progression of liver fibrosis. Those are the main measures that we depend on the blood parameters: the aminotransferases, ALT, ASTs, GOT and SGEPT, platelets, and serum albumin. And recently, we can use the histogram. Histogram, this is a very sophisticated technique, can be used by ultrasonography and needs experience. Where we previously published and published in the American Gastroenterology about the APRI score. APRI score is the AST platelet ratio index, and it's correlating a ratio in between the level of the platelets and the AST to be correlated with the degree of rival fibrosis. Many of the literature declared that if the ratio is less than 0.7, we are talking about F1, F2, which are mild levels of cirrhosis. If it's more than 0.7, and especially if it's more than 1, this is F3 and F4 according to the Metafair score, and these are progressed forms of liver cirrhosis. When the APRI score is getting more than 0.7, this is a progression of fibrosis. When it's getting back, this is regression. And let me tell you that in the field of hepatology, talking about regression of cirrhosis is some sort of science fiction. We all know that cirrhosis, when it starts, it never stops. Well, according to the guidelines of the American Society of Study of Liver Disease, they declared in the patients of NASH that weight loss 3 to 5% at least, and up to 10% is recommended to treat such patients. But here in that study that I'm conducting, we are not talking about NASH. Also, we are not talking about virus C. For the first time, this is a combined patients. Those patients, 68 patients, were collected to be prepared for the enrollment of the interferon therapy. If you know that interferon therapy is an approved therapy for the HCV, and they are both obese and HCV positive. All the medications and the liver support and the vitamin E were stopped totally. And these patients were introduced to the study by elevated liver enzymes. And as I told you, we can't know precisely what is the cause. It's not the viremia by the virus C or the NASH by the steatosis present in the liver. We adopted a diet plan, a dietary plan for those patients, mostly rich in fibers to promote the gut bacteria for the gut liver axis. We used, this, it's a famous meal in Egypt. This is the Egyptian beans, full mostly. Beans, if you know beans. It's cooked in such a way, and every patient was asked to eat such a meal daily in the breakfast. In addition to fruits and vegetables, a big plate of salad. In addition to mild exercise. Surprisingly, we noted a reduction of the APRI score. Most of these patients were introduced to the study with a high APRI score that is concurrent with F3 or F4. Now, it's getting low, less than 0.7. It's F1 or F2. And surprisingly also, the AST-ALT ratio, the AAR ratio, was not that significant. Denoting the matter, it's not the matter of viremia. It's more or less a matter of nutrition. Those patients are suffering from the fatty liver, the NAFLD, the NASH, not the viremia. As far as the statistics mentioned that 20% of the F1 patients only end in the form of end-stage liver disease. But actually, we are seeing more. We are seeing more than 65% of those patients, F1, ending as end-stage liver disease. We think that the virology is not the cause. We think that an additional factor is, which is non-alcoholic steatohepatitis. This is, as I mentioned, the AST-ALT ratio, which wasn't significant. And this is the APRI score. The blue column denotes that 45% were less than 0.7 before the dietary management. After the dietary management, they got into 68%. And those who were more than 0.7% were 55, declined to be 32%. The APRI score were different. As I mentioned before, the guidelines declared that starting from 2 to 3% up to 10% of weight reduction is very enough to treat NASH. But in this case, combined with virus C, we denoted that weight loss more than 10% is also beneficial. We monitored this. This is when this is less than 10%, still beneficial. But when you progress more than 10%, it's very beneficial also. So weight loss should continue. It's not a matter of percentage, 2, 3%, or even 10%. As far as you can get less, it's better. Better for the liver. How about the age? We noted that patients aged more than 45 years old is a bit difficult to lessen their APRI score. However, patients younger than 45 years old, it was very significant that they improved and they benefit from the dietary management. This is because the sarcopenia, the aging, I'm not sure. Also, we had only 12 patients out of the 70 patients. We have 12 patients diabetic. The diabetic didn't improve out of the dietary management. Surprisingly, those who weren't diabetic benefited more from the liver. Denoting also it's a matter of metabolic error. It's not just a weight loss. Also, the diabetic lose the weight, but they didn't improve liver-wise. Their aminotransferases and the platelets and the APRI score didn't improve like others who weren't diabetic. Our conclusions that for the first time, we have to declare that we need the help of nutrition. It's not only a matter of medications or antivirals. By the way, the interferon therapy is not a funny journey. Its response is only 60%. And the patients calls it, as far as I know, it's antiviral therapy, but the patient call it as a chemotherapy. It makes their hair fall. I've seen 2 patients committed suicide out of depression caused by the interferon therapy. And it's only beneficial by 60%. What I'm saying that we have to declare that we need the help of nutrition. Morbid obesity and HCV can act synergistically with liver fibrosis and fighting each other. Each one is not less important than the other. We do recommend weight management program or even bariatric surgery should be adopted also for every patient who is HCV positive and obese. Thank you very much. That's all.
Do you know what is the percentually of vaccination for EBV hepatitis and EBC hepatitis and EA hepatitis in Egypt?
Well, what do you mean?
Because in Italy, the vaccination for EBV and EIV vaccination is very diffusion.
Well, you mean acute hepatitis or chronic hepatitis? Because it's different. I believe you mean chronic carriers, chronic hepatitis, right? Okay. If you are talking...
What I know is it's important to vaccination of first or 2 year of life.
Of course. Yes, if I understand well, you'd like to know the percentage of hepatitis C and B in Egypt, right? In Egypt. Chronic forms, right?
Yes, correct.
Okay. Regarding the C, the official numbers, as I told you, is 11 million per 85 millions. You can do the math. This is regarding the chronic carriers. There are no official numbers regarding the acute ones. Okay? And regarding the hepatitis B, we have 3 non-million patients. Hepatitis B, chronic carriers, not acute, of course. We believe the numbers are exceeding this. We believe that the unofficial numbers declaring up to the maximum number we've heard, 29 million patients. because we've informed before that 2013 is the year of declining the level of the hepatitis C virus in Egypt, and it didn't happen. Still, numbers are exceeding. We believe that we hope actually the new treatment, the new drug, Sovaldi, is going to be that beneficial, because its response, apart in comparison to the interferon, the previous drug, 60%, this one is 90%, which is a bliss.
Okay, thank you. I think this is very, very important for the future, okay, for Egypt.
Thank you.
Okay, thank you.
Okay, is it still time for questions?
Thank you very much for your nice talk. There is a recommendation of the American Association of Studying Liver Disease, and you refer to. And in this recommendation, they also state that vitamin E treatment should be or could be considered in the treatment of fatty liver disease.
That's
I would like to ask you what is your opinion, what is your consideration in Egypt? Do you consider this as an alternative in the treatment of these patients?
Thank you very much for that question. Actually, I wanted to ask that question. As far as my practice, okay, as I do practice with elevated, hundreds of patients per week, elevated liver enzymes, vitamin E is not that effective, out of my experience. But I may say that this is a combined pathology. This is a fatty liver plus virus C. So maybe this is out of viremia, maybe. But actually, as if you kindly mentioned, vitamin C is not a treatment for fatty liver. There is no alternative for dietary management and lifestyle modification. And that's why this is very evident for the diabetic patients. Diabetic patients are more than the others suffering from metabolic errors. So that's why the liver enzymes and the APRI score didn't improve like the others. Thank you very much.
Thank you.